Hi, everyone. Are you caught in the revolving door of infections and treatments only to fall sick again? Well, today, Dr. Maggie is going to unveil the strategy to permanently close that door.
I'm actually really tired of seeing people going on this hamster wheel. And it really is a hamster wheel where people will identify an infection, they try to kill it, and it comes back over and over and over again. And today we're going to talk about how do we break this cycle once and for all, and I have a special guest to boot. We're going to take a deep dive, and here we go.
Hi, everyone. Thank you so much for joining us for this very special Transform Table Talk Live. I'm Anna Manuel alongside Dr. Maggie Yu, and we are talking all about overcoming chronic infections. Dr. Maggie, people talk about this on the Facebook page a lot.
Yeah, we actually had a huge amount of questions the last 2 weeks about infection. And there were many types of infections that people talk about. And of course, we're talking about a lot of symptoms we're talking about chronic disease, a lot of symptoms that people are having. And of course, underlying it is infection. After thousands of questions, thousands of comments, we've curated a lot of those. And today, I'm really excited that we're actually going to bring on a real life case study that really demonstrates this pattern that we see over and over again. We're going to talk about what the problem is, why it occurs, and how we're going to break the cycle today.
Okay, so let's dive right into it if you want to and talk about what is the problem here? What are some of these infections that pop up so often that are so challenging to get rid of in the first place? And then if you do, they often come back.
Well, before we dive in, though, I want to actually take a note of the audience. Everybody who's in the audience that's watching right now, if you're currently an alumni or you're in one of our programs, I'd love for you to type in chat where you're watching from or what are some of the symptoms that you've overcome. If you're new to us, I would love for you to join our Facebook group. We'll put a link below. It's called Transform Your Health Naturally. And if you have any questions or comments, feel free to go ahead and get started and pop it into the comment section we're watching. And I would love to add your comments and feedback into our conveation today.
So from all over, by the way, already. So we're
okay. Portland, Oregon. Who's Portland, Oregon?
try to grant permission so we can see your name. We love to be able to see who you are when you're writing.
Fans watching from Honolulu. Somebody's watching from North Carolina. We got Vancouver, Washington. I love it. New Jersey. Hiring manager from New Jersey watching on YouTube. I love it. Oahu, Hawaii. Thank you so much. Kalapi, great to see you. Nathaniel's there. Awesome. All right, everybody. Thank you, everybody, for watching. And if you are watching from Facebook, you may have to grant permission for StreamYard to actually show your name. If you want your name to be shown, that'd be great.
Yeah, love
Australia, Meg. I love it. All right. So, Anne, you had a question for me.
Yeah, the question was, I want to talk about what are some of these common infections that we hear about so often that are so tricky and challenging to treat and get rid of.
And you guys have all heard the names. So you've heard about Candida, which is a fungal infection. You've heard about Epstein-Barr, a viral infection. You've heard about Lyme. You've heard about SIBO. You've heard about H. pylori. And on top of that, people also get frequent infections like chronic urinary tract infections, chronic ear, nose, and throat infections. So infection comes up a lot. And the problem is that a lot of people will go to the regular conventional doctors. Well, first of all, why does infection come up as such a big hot topic? Well, most of the people we're talking to in the audience, and I'm going to ask you guys to chime in right now. Get ready to go to keyboard and type in. Think about this. If any of you are dealing with any of these diagnoses or symptoms I'm going through, one of the culprits usually is infection. So think about it. Do you have irritable bowel syndrome? Do you have fibromyalgia? Do you have mast cell activation, histamine intolerance? Do you have POTS? Do you have autoimmune diseases like rheumatoid arthritis, Sjogren's, lichen sclerosis, scleroderma, right? Do you have chronic pain, brain fog, fatigue, right? Any and all of these symptoms, when you go see your conventional regular medical doctor, they don't have a lot of answers. You're lucky if you get a diagnosis. And even if you do, there's very little they can do for you. So many of you us included, will go seek the help of naturopathic or functional medicine providers. And a lot of times when you go, one of the first things they'll do is do some stool testing, or they'll take a list of your symptoms and be like, aha, you're dealing with an infection. And so how many of you out there, is this ringing a bell? Is this resonating with you? Here's the problem. You get diagnosed with these infections, right? And then you end up going into a series of treatments. So treatments can include antibiotics, antivirals, medications, supplements, IVs, elimination diets.
Mm-hmm.
If that worked, great. But the problem is, this is where the hamster wheel gets started. You may get better for a little while, and then it comes back over and over and over again. And that is a typical cycle.
And it's so frustrating for people because you think, okay, I'm gonna do it this time, and then the symptoms are still there.
Exactly. Well, a lot of people think if I get rid of these infections, then my other chronic health symptoms like my mast cell, my chronic pain, my autoimmune disorder can, hormonal imbalance, my insomnia could get better. The problem is that as you're circling round and round on this infection, in the kill, repeat, recur, repeat, kill, recur, repeat, recur cycle, the chronic health symptoms that you're still experiencing here don't actually get better, or they might get a little bit better, but the trajectory of that seems to just get worse and worse and worse. So it's almost like there's a hamster wheel going here, and this is just a downward hill trend that is going on this side concurrently. So this is a classic problem that we're seeing right now. And how many of you are actually seeing that? Well, and it costs a fortune to keep treating over and over again. I think about Lyme, and now let's add COVID and long haul into the mix as well, because that's a viral infection that not just infects, let's say, upper respiratory, but we know it causes major shifts and almost an infection in the gut, right? And we have a lot of people with long haul. So that is indeed a fortune to actually go to long haul clinics, Lyme clinics, SIBO clinics, go through these protocols and treatments. Many of these are IV treatments over and over again. I mean, and that's where we are at today. Lots of money, lots of time, lots of effort, lots of elimination diets, and people are still sick and getting sick more and more.
Lots of frustration, because it's like you said, you're putting so much effort into this, and all you want is a positive outcome here. But unfortunately, it's just not what happens. Time and time again, people are coming to you saying, hey, I've tried to kill this infection half dozen times even, and it's still with me, and I'm still experiencing all of these debilitating, in some cases, symptoms that I just can't live with any longer.
Well, and this is how many and most of the individuals that come to us when you're coming to transform, they present with these chronic symptoms or diagnoses, and they have a lot of questions and past experiences, past trauma around infection. And that's why I want to introduce Brandy here. And without further ado, I'm going to introduce Brandy, who we've been working with in the past year. Brandy, welcome.
Hello. I'm the poster child. I really am.
Well, I mean, you're typical in a lot of ways of how someone presents at our door. And so as you're talking, I would love for you to give people a little bit about your background, when this started, who you are, when this started for you. And as Brandy's talking, if you're an alumni and you've been through you've been going through the program with Brandy, type in chat. If anything of what she says resonates with you, go ahead and type it in chat for everyone. Go for it, Brandy.
All right. Hey, everybody. I'm 45. I have a child who just turned 16, and most of my problems did start about 16 years ago, around the time she was born.
Postpartum hormones, everybody.
Absolutely. Yeah. And so my health went downhill, and for 10 years, I went to 5 naturopaths, dermatologists, GI doctors, all the things, no answers, and kept getting sicker. And about a year and a half ago, I found a naturopath who gave me some diagnoses and a place to start. But like you say, Maggie, everything she tested me for came back positive, which was strange. And so started the treatments, the aggressive medications, the supplements, the IVs, all the things you named. And I just kept getting sicker and sicker and sicker.
Brandy, I want to hear about that. You said you went downhill and you got sicker and sicker. Specifically, what were you up against? What kind of symptoms?
Well, it started with rapid weight loss. I'm already a small person, but I lost like 15 pounds, As a nursing mother, I was no longer able to make milk for my child. I started having skin sensitivity reactions, a lot of like unexplainable rashes, debilitating stomach pain, like true story, many iterations to ER, contrast dye injections, sonograms, ultrasounds. Guess what? I was always told, we didn't find anything, you're fine. And I would get sent away. And so that was really frustrating. And that was the path I was on for a good 10 years of fatigue, brain fog, chronic pain, hormonal issues, and no answers.
So you said you about a year ago, I think this is about 2 years ago, you finally found a naturopath. I mean, you had been working with conventional doctors up to that point and being told everything was fine. 15 years, 13 years of this. And then 2 years ago, you finally saw a naturopathic provider and you were diagnosed with a slew of things. What were some of the infections or things you were diagnosed with?
Lyme disease with Bartonella co-infection.
Right.
Reactivated Epstein-Barr virus. HHV6, which is another herpes type virus. Recurring SIBO. And she diagnosed me with Hashimoto's. It was the first person who tested my antibodies. So we did discover Hashimoto's there as well.
And so an autoimmune disease to boot on top of that.
Yes.
So it's an interesting thing is because I think, Brandy, your story highlights sometimes diagnostic difficulties, which means that, you know, you go to your regular doctors all these years, get diagnosed with nothing, and you're getting worse and worse. Yet sometimes you'll go to a naturopath or functional medicine clinic or a doctor and you get diagnosed with 10 things. And I think that there are some inherent, I want to highlight this as there's some diagnostic problems. Some of these tests, it's interesting. And I remember 10 years ago, as a conventional medical doctor doing a lot of functional medicine training and work, there were a lot of patients coming to me from various other doctors. And it was interesting to me how so many there were naturopaths and functional doctors in our community known as, for example, Lyme doctors. And yet every single person that went to them had Lyme. Now, I don't know if that's statistically possible that every single person that goes to them have Lyme, but that was the case. And so I think that the hard part in this is that diagnostic testing around some of these infections are really tricky. Depending on how you test, even for something, let's say using Lyme as an example, depending on the kind of lab you do, there could be quite a few people who can test false positive. There's a lot of people we call equivocal. They're like borderline that a lot of people will be calling positive Lyme. So it's an interesting thing. Just Lyme itself is an example of something that can be difficult to diagnose. And there are some, and even when you go to get training around Lyme and Lyme testing, one doctor will say, this is what I use, and that's the gold standard, but this is what I use. So there's a lot of controversy even around diagnosis. That's just Lyme.
Absolutely.
When we talk about Epstein-Barr, here's the other problem. People with autoimmunity like Brandy, Hashimoto's, like myself with mixed connective tissue and Hashimoto's, we frequently can, because of our altered immune system, which is very hyperactive, our immune system, instead of attacking germs, is busy trying to attack us, can actually on Epstein-Barr testing read positive for a long time, even if it really isn't active in you. So there's a lot of it's tricky also diagnosing Epstein-Barr virus. And then thirdly, you start talking about Candida and some of these other infections where a lot of doctors will even diagnose you without even doing adequate testing and just say, you look and feel like you have Candida. And we know how important accurate data really is in diagnosing these infections. And yet, people come in with all sorts of various ways of misdiagnosis all the time. So I don't know about you in your case, but I'm curious how many people in the audience have struggled with getting a diagnosis or felt like they were misdiagnosed or overdiagnosed with something or diagnosed without even any data. Anne, was that you?
Yeah, when you mentioned Candida just now, that's exactly a conversation that I had with my functional medicine doctor. She said, well, a lot of this stuff that you're describing sounds probably like Candida. We can go ahead and just start treating you as if it were, or we did at one point. And then about a year later, she came back. She's like, let's just test for it. And the testing was not the same kind of testing that you did on us and that you take in your program. And so it didn't come back with any kind of results that I trust now. And I'm not even sure that she trusted it. So it felt like some pointless testing, truly. Like you mentioned, the diagnostic issue is rampant when it comes to this kind of testing.
Look, if you're going to try to kill an infection, I'm not going to do I feel your aura type of diagnostics. Okay.
Yeah.
That is not a diagnostic. I am not a savant in feeling your infectious aura. I need the hard data with this. So this is why we have, we have various different programs and we got to customize and personalize the program to the right person. But there is in one of our programs diagnostic testing, and that I affectionately call the poo-poo platter. And it is like, and it's interesting, and you might have said she thought you had Candida and all that, but you might find that when you actually do all the data analysis that we actually do, that might not have been your problem at all. And interestingly, if you're doing things by symptoms only, many things can look like you have a Candida infection that may have nothing to do with a Candida infection. And in your case, there was a huge surprise.
Well, I did have Candida, 2 different strains, but I had some other way worse infections brewing in there. Has anyone ever heard of E. coli? So Maggie called me after she got the results. She said, just so you know, we might be getting a call from the health department per year. So what's going on here? Like, do we need to be hospitalized? Because there were some serious infections. I think I had 7 different infections that were all brewing and none wasn't getting treated. I certainly wasn't getting help. Outside of you, Dr. Maggie.
Well, I have something I'd like to share, if you don't mind, Maggie, is that it's a double-edged sword, because after, 10 plus years of seeking and being sick and trying to heal my body, having someone hand me some diagnoses actually felt like validation and relief. So then you think, finally, I know where to look. I know what to do and how to treat, because to be honest, before this naturopath who went down this path with me, I had been offered a hysterectomy twice by 2 different gynecologists because that was their solution for my reproductive health issues. So at least this person was going to allow me to keep my, reproductive health organs, and she was going to look somewhere else. And so in a way I was relieved. And then a year into it, the relief turned to overwhelm, anxiety, fear, despair, thinking, oh my gosh, because someone said this earlier, you're right. It cost me, I paid out of pocket for this naturopath for all the tests, for all the appointments, for all the supplements and medications, over $10,000 in a year.
Yeah.
So that did add up quickly.
To stay sick.
But here's the thing. Let's say you were accurately diagnosed. Many of you out there have been accurately diagnosed, and then go through the $10,000, 1 round, 2 round, 3 rounds of treatment over and over again. How many of you had it come back? Type it in chat. How many of you had these infections come back over and over again? This is the interesting thing. I think that fundamentally the approach of diagnosing gut infections first and trying to treat and kill infections first over and over again, absolutely, to me, is the wrong order. It's the wrong order. That's not how we should be approaching these chronic health, chronic disease symptoms when there's infection. So here's what I think, okay? And my experience. And this is what I've seen thousands of times over and over and again. I'm almost 30 years in practice at this point. What I've seen is that people who have any sort of these symptoms or diagnoses that I'm talking about generally have some underlying problems with inflammation, with their immune system that are going on, food allergies. There's many sort of root causes, things that are going on in the first place. This, and we'll go into Brandy's case to actually highlight these things. To me, this is what I call, these are the root problems. If you think about, I think of it like, is it the head of a lizard problem or is it a tail of a lizard problem? So this is an analogy, everybody. But I remember as a kid, when you lop off the tail of a lizard, it's wiggling around all this stuff, but then it grows right back over and over again, because that's not where the real problem really is. Where the problem's really coming from is from the head or the body of the lizard, which to me is the environment that we're sitting in, the immune system we're sitting in, the environment that we're sitting in that makes you so susceptible to that infection in the first place. So here's the problem. You say, oh my gosh, there's all these infections growing out of here. Let's get rid of the infection, lock the infection off, lock the infection off. Environment doesn't change. Let's say there's 1% of Lyme sitting there, 1% of E. coli sitting there. It says, I'm not gone yet. The environment is still here. Let's go back and do a poo-poo party all over again, over and over again. So I actually think this whole thing is you get relief going and saying, now I have a diagnosis of these 7 infections and I have a plan. I'm going in to treat this over and over again. When in reality, you've just created a red herring wheel, hamster wheel on the side over and over again. Because how did you do as you went through those 7, different types of infections getting treated?
Well, my body did not handle it well, right? I couldn't even detox all the things I was killing.
Big problem.
And even trying to support with like liposomal glutathione or IV glutathione, none of the things that we were doing that were supposed to, help inflammation, help infection, help detoxification, they just weren't effective. I was getting even, vitamins and nutrients by IV, by injection, but I was still fatigued. I was still brain fogged. I was still having pain, and I was still sick. And it was crazy. I was like, how can I be doing all of these things for my body and my body is not responding? I understand now, a year and a half later, after starting the program, why? Because you're right. The environment wasn't changing. Mm-hmm. My detoxification pathways were wrecked. My adrenals were shot. My thyroid was dysregulated, and my immune system was not working for me. It just absolutely wasn't. And I felt, and I shared this earlier in a pod, is that after a while, it gets dark. My thoughts go, you go to a dark place. You either start feeling like I'm never going to feel well. I'm never going to heal. You're expecting worst case scenario diagnoses coming down the pike, or you just feel like this isn't living and I don't want to live anymore. And that is really how dark it got for me. And for people who know me, that might surprise them to hear that, but that is where I was.
I'm sorry you were in that place, Brandy, but I know, and thank you for sharing that, because I know you're not alone. A lot of people probably feel that exact same way as they're struggling with these chronic health issues, specifically infection, that can be so frustrating.
So, this is great because I want to tie a couple things that Brandy said together. So those of you in the audience, take notes. Think about this for a second. There are pieces in her story that to me is a pattern I see over and over again. Her problem started postpartum right after the birth of her daughter. And that was 15, 16 years ago. So it's interesting because I talk about how hormones and times a big hormone change really makes us really vulnerable to any sort of infection, autoimmune or immune changes, and inflammatory changes, and infectious changes. So these are what I call hormonally vulnerable times. And what's interesting is that I just want you guys to think about hormones in terms of hormones are made, but hormones are also broken down. And the breaking down of the hormones is utilizing your liver's detoxification system and your large intestinal bacteria's detoxification system. You can't break down hormones if your liver and your large intestinal bacteria are not functioning properly at breaking hormones and toxins down and getting them out. So to me, it's unfathomable to go into somebody who has these infections that really started for Brandy, huge hormonal dysregulation, huge hormonal imbalances, and say, we're just going to kill a whole mess of stuff. So this is what happens. You kill this whole mess of stuff. Let's just say Lyme. You know what happens with Lyme? When you kill Lyme, they actually explode the virus in the cells, and it releases a whole lot of toxins from inside your cells. There's a huge, what we call hexamer reaction or die-off with every round of Lyme treatment. That could be so bad that it could feel like life-threatening. So that's the problem here, is that there's an underlying hormone dysregulation or imbalance that started out triggering a whole hell of a lot of immune problems, autoimmune problems, inflammation problems, infection problems. But yet we're sitting here just kill, kill, kill. Meanwhile, nobody's dealing with the hormones. Nobody's dealing with the liver to help her break down hormones and toxins. And no one's working with her large intestinal bacteria to balance that gut microbiome so it can break down those toxins and those hormone breakdown products.
Well, Yeah, my body, like I had an emergency C-section. I want to point this out. I had an abdominal surgery for my labor and delivery. No one ever talked to me about the importance of how to support my GI going forward after an abdominal surgery. And so that's something else that is so wild to me, that only after coming into the program did Dr. Maggie talk about supplementing with, digestive enzymes and probiotics and, getting that dysbiosis corrected. And that's 16 years after an abdominal surgery. She was the first person that ever talked to me about that. That is just wild to me.
Well, you know what's wild? You just mentioned the word digestion, and we're going to just talk about digestion. I'm going to logically, and this is where you guys need to take notes. Logically, I want you to think about what is digestion. When you think about digestion, you think of just, food coming through me, getting digested, turned into poop. No. Do you know that every step in your digestion is actually your body's natural defense against infections? So very first step, stomach acid. Think about that. We use vinegar to clean, disinfect, sanitize. And yet there are studies that actually show that most people with chronic disease, and I'll use autoimmune disease as an example. People with autoimmune disease, 90% of them in a study had very low stomach acid. And then you wonder why people with autoimmune disease have tons of infections. The very first line of defense doesn't even exist, or it's really low. So I'm curious, Brandy, using yourself as an example, what did you discover about your digestion through the program?
Well, I discovered that I absolutely need digest it in order to. So let me just say, everything I was eating, that's how it felt. I felt like everything I was eating prior to the program was causing a reaction. I was convinced that I was allergic to food, like a lot of people do. I had food fear, food trauma. I had eliminated gluten, dairy, soy, FODMAPs, histamines. I don't eat meat, so what the hell is left? Very little.
No wonder you lost 15 pounds, lady.
Yes. And I was having itching, crawling sensations, rash. So I was like,
reactions.
Right. And so turns out it wasn't food. Turns out it was digestion. I needed stomach acid. I needed ox bile. I learned later, fast forward, that I genetically make low elastase. So we know that my pancreas wasn't working for me either. But these are the pieces I got to put together. And probiotics. When I started taking Digest It and probiotics, I came into this program, chronic constipation, distended stomach, pain, bloating, gas, all of it. I was given prescription medication for constipation that did nothing. 6 days into starting the program, drinking water, starting supplementing my digestion, everything changed. Suddenly I was having regular bowel movements again. I no longer felt toxic. I was no longer itching. It was too simple. It was too simple.
I mean, you were dealing with this for over a decade, and then in a week, it turned around.
Yeah, within 6 days, I was having like bowel movements again, and within, excuse me, a few weeks, like my stomach issues just relinquished. It was unexpected because it seemed like too simple after everything I had done, right? But that's what was needed.
Well, and that's the thing. I mean, I think it's logical, and yet it's not the logical order with which we deal with infection. I mean, she goes through $10,000 and how many rounds of trying to kill 7 organisms, yet nobody's educating her and addressing digestion with her, which is the defense against more and more infectious organisms coming in. Right. Doesn't it make sense to actually protect your front door?
Yes. Now it does. Right, Ann?
Angie just said, same here. No constipation within a week of starting the program. Elaine jumps in and says, Digest It helped my digestion's issues so much. In a way, it's like, it's almost too simple, but the fact is that you don't have to take my word for it. Like you got to take a look at the results that people have with this. I find that digestion is the holy grail that nobody knows about, including your doctors. And so to me, one of the most important things, I'm going to say it again right now, the most important thing, if you're dealing with a chronic infection of any kind, is protect your front door. Every single door through which everything passes in your digestion, it's got to be protected with digestive support, because so many of the reasons why you have a chronic disease or a chronic symptom is because one or multiple steps there are broken.
Yes.
Okay.
Well, and so I went to a GI doctor. We did stool testing once upon a time. And they found fat in my stool. I had lost 15 pounds. My stools were floating. And guess what they told me? We just found a little fat in your stool. You're good. They gave me no indication of why I would have fat in my stool.
Why the hell would you have fat in your stool?
Unless and nothing to do about it. Right.
I can relate to that as well, Brandy, because I had expensive testing done, so many different tests I felt like to try to diagnose whether it was your nutrients being evaluated or your stool being evaluated. And each time it would have some information in there, but I felt like my practitioner was just like, it's not that bad, like it'll be okay. We'll just, stay the course. But yet the course wasn't working and we weren't doing anything to interrupt that cycle.
Agreed. So I think digestion was one of the things I wanted to point out and pull out of her story. But there's another part of her story that we just talked about. You mentioned probiotics. Okay. And I just mentioned that in order to detoxify toxins, break down toxins in your body, in order to balance your hormones in the body, there are 2 major steps you have to think about to make sure your body detox. Detox is important. First step in your liver. Okay. We'll talk about that more a little bit later. Second step is your gut microbiome, which is the good beneficial bacteria in your large intestine, right? And meanwhile, we're pummeling you with what? Antibiotics, supplements, IVs to kill bacteria. What happened to all the good bacteria then? They're getting killed too.
Yeah.
And they're really important in breaking down those toxins, balancing our hormones. So what did you do? What did you discover about your good bacteria in your gut, Brandy?
My bacteria was imbalanced and my fermentation was crap. And I also learned that the immune system in my gut wasn't working for me. I mean, actually every step of my digestion that we tested in your programs came back to say, no bueno, good. Yeah. Not working for me. And so I definitely needed to support the diversity in my gut and the balance of bacteria in my gut. And you found additional pathogens that we hadn't found before. I had strep that was seeding into my gut from my oral cavity, which I didn't know about. So I wasn't taking care of that issue that was creating, I would fight the SIBO, but things were coming back because I hadn't addressed the root cause.
Oral, like think about this, everybody. So here's the other thing is like she could be sitting here dealing with Lyme, Candida, multiple Epstein-Barr, all these other infections, right? Or SIBO as well. But the problem is like a lot of times on these stool tests, the functional practitioners ignore some of these other flora. They're actually ear, nose, throat, and dental that continue to seed the problem. I haven't met a single naturopathic functional medicine doctor that's actually addressing those. So let's talk about even just probiotics, bringing it back to probiotics. For me, here's a learning point. Write this down, everybody. It's really important to actually take a variety of couples. I would not just one, I would say at least 2 probiotics and rotate them. Why? Number 1, you want to actually strengthen the number of what we call keystone species of beneficial bacteria. These are the bacteria that are like, let's think about them as utility workers in your earth. And you need a high number of utility workers doing all sorts of utilities in this earth, which is your microbiome, right? So Proflora AI, I think, is really a great one to take. That's Proflora AI, and that would be really populating the keystone species. Now, that particular formula with AI has specific strains that does specific activities. So, for example, Brandy mentioned that she had a lot of rash reactions. How many of you have a lot of allergic reactions getting worse more and more and more over time? And you're like, what the heck's going on? Well, there are actually specific beneficial bacterial strains that are really helpful for people with a lot of histamine reactions. And that's in Proflora AI, number 1. Number 2, Proflora GI would be the second probiotic I would consider rotating. Why is Proflora GI awesome? Well, think about there's certain strains of bacteria that are really good that are more anti-infection. So we can use beneficial bacteria to also shift the microbiome to be more infection, meaning more kill oriented. Proflora GI is really great to support that. And I'm going to throw in 2 other like freebie advice. Okay. So bonus section. Number 3, if you're really thinking, and I know this because we do stool testing, there are people with really low gut diversity, meaning that the number of different kinds of utility workers are really low, right? So then what's a really effective way to also increase the number of diverse types of bacteria? That's a spore probiotic. So in our probiotic collection, which we'll put a link down. You have Proflora AI, you have Proflora GI, and you also have a spore-based probiotic. Rotating the 3 of those can be really a great regimen to actually increase gut diversity. That being said, Brandy said in her story, ear, nose, and throat. What can you do to keep the seeding from the ear, nose, and throat? Bonus section, everybody. A chewable, it's called Proflora chewable. It's a chewable.
And it's so good.
Tastes so good. Kids love it.
Yeah,
but adults with dental, ear, nose, and throat seeding also take it. Why? It topically, like right in your ear, nose, and throat, populates good bacteria in there, it directly there. Because if you swallow a capsule, it goes in your gut. So if you're the practitioner or you don't recognize how much seeding is coming from up here and you don't take a topical, like in the ear, nose, and throat area probiotic, you're not going to stop that seeding.
And I did have chronic sinus issues before I came into the program. And since I've been doing the chewable probiotic, my sinuses are so much better. I had constant postnasal drip, drainage, runny nose, all of those things. So not only do I know I'm, helping with the oral microbiome and the seeding of the gut, but my sinuses have been so much better since being on that probiotic as well.
And then here's the other thing, Rhiannon, in here in the comment section. This is a really good comment. Thank you for all the comments, everybody. Keep popping your questions and your comments in chat. I'm watching them. She says, my GI doctor, this is a pet peeve. This is pet peeve time, everybody. And I love it. My GI doctor straight up told me to stop taking my probiotics because there's not enough evidence that show probiotics help or do anything. This is a GI doctor who's never read the evidence. There are thousands upon thousands upon thousands of studies that actually show that specific strains of probiotics are absolutely beneficial in many, many, many types of symptoms and diagnoses, including even cancer, everybody. So So here's the thing. I mean, I would say my biggest shame as a doctor, and I'm speaking for many of these GI doctors as well. Look, I was there too. I'll tell you right now, in all of my medical school training, all of my years as a resident, all of my years as a practicing doctor, I'm now 27 years in practice right now. Do you guys know the total amount of time I spent learning about supplements or probiotics?
How much?
30 minutes.
Oh.
You in the audience right now already spent more time learning about it than I ever did in my 27-year career until I got sick.
So of course her doctor, who is a GI specialist, is going to tell her, hey, there's not enough evidence because they haven't seen the evidence. They haven't studied this at all. But that it feels criminal to give someone that information.
I think it's malpractice. I'll be honest with you. I think to say that there are no studies around the role of probiotics, I think is absolutely not even true. If you haven't looked at the audience, if you haven't looked at the evidence, be honest, you haven't looked at the evidence. Don't sit here and poo-poo it just because you don't know, right?
Well, and I took out a lot of things from my diet that would have been supporting my digestion because I was avoiding histamine, high histamine foods. And so I was taking away ferments and things like that were actually beneficial, but I was afraid to have them because of the reactions I was having. And you know what? All of those things have come back. I can have all of those things again. I never needed to take them out to begin with.
Well, let's talk about that because so how many of you guys out there dealing with infection have been on a vast amount of the SIBO diet, the low FODMAP diet, the Candida diet? How many of you had to go on some pretty extreme diets actually trying to deal with your infection, right? And hey, if that was successful, then great. But if that wasn't and the infections just came back over and over again, then not great. That's not a good use of your time, energy, money, or effort. And on top of it, elimination diets are not meant to be long-term. They're meant to be short-term. And long-term elimination diets can actually make you more malnourished, more sick. And sometimes even, I can go on about this, but here's the thing. How the heck would you know what to eliminate if you don't have food mapping data around it? Right? I'm curious, because a lot in the Transform system, we have a food mapping system where we figure out precisely using your data which foods is actually triggering your chronic disease symptoms or the environment in your gut, right? So if you don't have that data, you're just thinking I'm going to go on this diet, low histamine diet, the FODMAP diet, the carnivore diet, this diet, that diet, but it's not based on data. And the problem with not basing on data is when you eliminate large groups of food, you're going to be eating and introducing or increasing the amount of a lot of other foods you may actually have a problem with. or you might be eliminating some really nutrient dense foods that you need to actually fight these infections or heal. So in your case, based on your food mapping, Brandy, most people assume you're going to have to eliminate a shit ton more food. So what really happened with you?
One thing.
This one. What
Literally onions.
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 Was that something you ever would have suspected?
No, and I love onions and I was having them every day. But it was the only thing that came back. And it was not something I expected because onions are antimicrobial and they're so good for you. And so, of course, I was having lots of onion and garlic in my diet. Plus, I'm Southern. So, of course, I am. Right. But one thing, y'all, one thing.
One thing, y'all. And she was on what? FODMAP hell for how long?
And I was eating I felt like I was eating like 5 foods when I came into the program. I was afraid to eat everything. Just eating caused problems. And so it didn't matter what I was eating. It was just eating itself that was the issue because my digestion was so broken. But I thought it was every food that I somehow, you know what I'm saying? Like, that's not a rational way. That's not rational, but that's where I was.
Well, I mean, I'm looking in the messages here, and Brandy, the other Brandy D here says, you know, I know, Brandy, you said you could eat like 5 foods, you thought,
Mm-hmm.
and Brandy here said 10 foods.
Mm-hmm.
How the heck are you supposed to get rid of these infections eating 10 foods, and in your case, 5 foods, without getting sicker and sicker and sicker when they weren't even, I mean, it wasn't even, those other foods weren't even the problem. So here's a question. Once you had you went through the food mapping system and you got your data, what were you mostly doing? You went from 5 foods. Where are you at now with the number of foods?
I mean, everything but onions. You know what I mean? It was exciting because I love food. I'm a foodie, you know. It just shuts down your life so much to have to avoid food, avoid dining out, avoid socializing around food.
Mm-hmm.
And you also can feel like somewhat of a burden. And I know that you all understand this, or like, you know, you have all these accommodations and needs. And so you're not so fun, right? Mm-hmm. And so it really opened up a lot of things. It wasn't even just about being able to eat. It was about my social life. It was about my work life. It was about having meals with my family. Like, all of that changed when I understood that I didn't need to be afraid of eating anymore, that I could actually enjoy eating and enjoy eating socially again.
Well, I want to bring back to, what is the social cost of having these infections, these chronic symptoms for like the past 15, 16 years of your life?
Mm-hmm.
So we didn't even talk about that. How did that impact upon your job, schooling, family life, you as your own view of you as a person? Well,
I'll try not to get emotional, but I left. It was the fall of 2019 because it was right before the pandemic. I studied public health. I worked in community health. I was a community health worker at a local nonprofit. I was the program coordinator working with folks experiencing extreme homelessness and poverty. I was very passionate about my job. I loved what I was doing. I was making an impact on the world, and I got so sick that I had to leave school. And I had to leave that job. And then the pandemic happened. And so that gave me a little bit of a buffer, but it was devastating. It was devastating because my identity was wrapped up in my job and my schooling. That was who I was. And I had purpose with that job and with what I was doing. And I felt like I lost my identity. I lost my purpose. I felt like, you know, I wasn't doing anything that mattered anymore. And on top of that, I felt like a burden to my family, like a financial burden, and just a burden because I could not, you know, I did have to withdraw. I did have to isolate. I had to turn down invites. I wasn't going out. I wasn't going out to shows. I love music. I love to see live music and bands. I'm not going to parties and shows. I'm not going out for meals. I had quit drinking years ago, so I wasn't going out to drink anyway, but like my life really changed. My bubble got very small and it was very lonely. And you want to talk about dark? That's where that darkness comes in, right? Like there was not much of a life left at that point.
And Brandy, what was it specifically about why you were feeling so sick that caused you to leave the job? It was specifically the fatigue.
I had such severe brain fog. I couldn't do simple math anymore. I couldn't even recall words. I couldn't remember people's names. I was the coordinator. I was supposed to orchestrate what was happening at my job, and I could not do simple math anymore. I was laying in my office in a fetal position many times with debilitating stomach pain. Like I was calling out of work a lot. I was not able to go into work. I could not get off the sofa, get out of bed. It was the fatigue, the pain, it was the brain fog, it was everything.
Got it.
Question.
Yeah.
Where are you now?
Well, let's see. Well, I'm back to work.
Yeah.
I have 2 jobs now. This coming into the program actually created an opportunity for me to go back to work in my field, working in health, which is, for those of you who don't know, Maggie asked me to work for Transform. And so for the last 10 months, I've not only continued to work and, go back to school and get straight A's, I got my brain back, but I actually had an opportunity come my way because of my participation in the program. And that has been a huge gift.
Yeah, and you are currently a pod leader, leading a lot of the participants through our program. That's why so many people in the chat are like, "Hi, Brandy." Lois just said Brandy is an amazing pod leader. But the thing is, I think the thing is that I want people to recognize that what happened. So you're currently working 2 jobs, number one,
And I'm back at school.
You're back at school in your master's of public health.
And I have been going to shows and sing live music with my daughter, with my partner. I think I've gone to 3 shows already this summer, and I have something else coming up later this week that I'm taking my daughter to. So I'm going out, I'm living life. I'm joyful.
Yeah.
A total turnaround. What do you think you would say to some of these practitioners that you worked with in the past that caused you so much frustration knowing what you know now?
Thank you.
Mm-hmm.
Because everything they did led me to where I am today.
Yeah.
That's a true answer.
Yeah.
Yeah. I like that. And I think, yep, I agree with that. I do think that when you're looking at conventional doctors, it's not like they're purposely trying to do harm, right? But they don't know what they don't know. Right. And one of the things I really love about our programs is we're here to educate you. To me, honestly, to be 10, 20, 30 times smarter than anybody you'll ever work with. And interestingly, too, is Brandy has worked and is working with naturopathic physicians. One of the things that I'm really proud of is also educating our people in our programs on how to find natural or functional medicine doctors that you can work with, collaborate with you. How do you actually join or invite in educated collaborative conversations, right? So that they can work with you. How do you identify that, right? Chris just said, Anne-Marie just said, such a gift to get your brain back. I was going to say, Brandy, I remember you a year ago on one of your first calls.
Yeah, probably was not pretty.
What was it like, Dr. Maggie? Just, you could tell that she was searching for the right
Well,
word.
most people entered the program with extreme amount of brain fog, fatigue, right?
I had anxiety.
Right.
I had anxiety. I cried a lot.
Yep.
I remember crying a lot. It was emotional.
Mm-hmm.
It was hard. It was hard to be vulnerable.
Mm-hmm.
And yeah, that was not a place I wanted to be.
I love it. And in summary, a couple things, everybody. Number one, we talked about how important it was for digestion. I'm just looking at my notes here. There was so much that we went through. Digestion, huge, right? Number two, we talked about probiotics and how important probiotics and the role of the microbiome is. Number three, how important actually accurate food mapping is to the food mapping system was for Brandy to reintroduce and add back a whole lot of foods, right? One thing we didn't touch a lot on that I'm just going to touch right here is that we did start out talking about how hormone changes was the triggering event in Brandy's life.
Yeah.
Right? To me, that's why it's really critical for people to understand, no matter what diagnosis or symptom you're struggling with right now, I know for a fact that the hormone imbalance is one of the triggering events, number one, but also exacerbating factors. So for me, that's why we have my hormone masterclass, where you got to get your hormones tested. You got to learn to understand what these patterns are, and you got to understand what you can do about it. So I'm curious, Brandy, what hormone patterns did you discover about yourself?
Well, I had low everything and stage 2 going into stage 3 adrenal fatigue. So I pretty much had stopped making hormones, which at 44 when I came into the program was unacceptable. And it was no wonder I was feeling so tired.
Well, and a lot of people assume that if you're working with a naturopath, that they would have tested or diagnosed you with no hormones or adrenal fatigue. Did that happen for you?
We did test my hormones in blood and they always looked good.
Blood, right?
Yeah.
So there's tons of video trainings, everybody. If you're interested in learning to get a hormone checklist or our handbook, our guide around that, type in chat if you want to know how many of my symptoms could be hormone related, right? Put hormone checklist in the chat. We have a checklist and a guide together that you can get as a resource. Just go ahead and type that in chat. I really think that the hormone piece, and someone wrote that they had testosterone level of like blood levels of something in the chat and all that. How many of you guys know that your hormones being out of balance was the triggering event in you getting sick? And the imbalance is continuing these symptoms. So for me, there's absolutely no reason that someone in the early 40s should have, you said low everything as well as stage 2 adrenal fatigue.
Yeah.
So I just reviewed a hormone result the other day with somebody. And if you're one of the ones watching and it was your hormone levels, but I see this every week, okay? I'll have somebody who's 53 who said, oh, you've had in that particular case, total hysterectomy. And so we shouldn't test you about, there you go, little lady. There's no reason to test your hormones. You shouldn't have any hormones. Beg, 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 get the hormones tested. Lo and behold, right? Oh, of course, your hormones are low. That's exactly what happens when you've had a hysterectomy or a total hysterectomy. But here we are, educated in this. Not only, number one, do we test the hormones correctly, right? Number two, you can have low levels of hormones that are post-hysterectomy, post-ovary removal, and it is not normal for someone who's 53, even post-hysterectomy, to have hormones of an 85-year-old, right? It's not like, oh, suddenly you're in this category and everybody in this category who's had a total hysterectomy should be at this level. I can go into it, but I won't. But if you guys want to check out some of my adrenal videos and hormone balancing videos, at least get the hormone checklist in the guide here. Type the word in chat. We'll get it to you. Or we'll post a link for you to download that checklist. I'm going to let you guys know that we call the adrenals the postmenopausal ovary. It still should continue to make hormones, many hormones, even if you've had a total hysterectomy. And in Brandy's case, she didn't have a total hysterectomy.
But I almost did, Maggie. That's what's crazy. You know what saved me from having my hysterectomy?
What?
The pandemic, because they pushed back procedures. Wow. It gave me time to figure things out and find you, but I was that close. And just think about that, because that was what I was told by conventional doctors who wouldn't test my hormones, that was the answer. That was the only option they offered me. And I'm so happy that it worked out the way that it did, because I didn't want that. And I didn't believe that was what I needed.
There's so many other people out there who don't have that same experience and who do end up getting their organs removed, and then have to then deal with the consequences that may come of that as well.
So here's the thing. I mean, here's an unintended, like we did the "Where are you now, Brandy?" But here's the thing is, she avoided a hysterectomy or a total hysterectomy that was completely medically unnecessary. Yeah. And how many people out there have had a hysterectomy or a total hysterectomy and have not only did it not resolve all the symptoms, but new symptoms and new problems came as a result of it afterwards, right? Type that into chat. So these are preventable problems. And it just goes to show you that we're using Brandy's case study here as an example of what we see people coming into who are interested in learning about me, the program, and our programs all the time, right? This is very typical. Brandy is not a super special rare zebra. In fact, I mean, there are hundreds of you guys, whether you're on YouTube, Facebook, that are watching this, LinkedIn, who have been commenting like crazy over here. This is literally an experience of every man, every woman that we talk to out there in one way or another. But what I'm really proud of is we've tied these pieces together. The bottom line here is this, is that you got to stop cutting the tail off the lizard over and over again. It's going to come back over and over again. There are key issues that you need to deal with. That's actually the head and body of the lizard that you got to deal with. These are the root causes. They include digestion. Oh, we didn't even talk about blood sugar. They include digestion, hormone imbalance, the role of the gut microbiome, the role of food mapping to either eliminate allergens or reintroduce a whole lot of food. So, I mean, this is huge.
Yes. And I think, go ahead, Anne.
Well, I agree. And it's a little bit sad to me because I've had a similar experience of going to different practitioners and trying so hard to get these answers and to focus on how do I fight chronic infection and how do I turn around my chronic diseases and symptoms. And you just don't get this holistic, full picture approach like Dr. Maggie is presenting today to really attack the head. You know, we're not interested in chopping off that tail of the evil lizard over and over and over again. When what we really want is to decapitate here.
Yeah.
Stop popping off. Stop going from the back end. We got to deal with the front end, everybody. All I'm saying. Yeah, absolutely. So for all of you guys that have been watching tonight, we're running into almost the hour mark, and there was so much more we could have gone into. We didn't even touch on the role of blood sugar here. What I would love is, what is the one big thing that was a big aha or takeaway? Type it in chat right now. Just one thing. If there's one thing you learned in here, put it in chat. Number two, if you're interested in getting checking out the digestive and GI supplements, it's in chat in the comment section, or you could type that into chat. We'll get it to you. We also had a hormone checklist and protocol that you can download if you wanted to do that. Go ahead and type that in chat. And there's also comments in there around that. If you're interested in learning more about our programs, we have a variety of different programs depending on what's going on with you. So what I would do is there's a link here to book a chat with our team. We got to learn about you and what's going on so we can customize and tailor something that's personally right for you.
Brandy, I just want to say, and you've received so much love in the chat from people who know you and from people who don't, but we're also happy that you're doing better. We thank you for sharing your journey and your story. And I'm sorry that it took you 15 years to finally get the answers that you needed and the guidance that you needed and the education that you needed. But you got it. And
I'm grateful for it.
Completely turned around. So thank you for being generous and sharing your story.
Thank you all for inviting me.
Thanks, y'all. Have a wonderful night.
Bye.
Bye.